everyone. Welcome to Fireside Creators. I am your host, Reverend Dr. Sherry Pallas. This week's show is on ableism, and we have an absolute amazing panel of perspectives. If you're watching on YouTube, please hit that like and subscribe. If you're on Facebook, register a StreamYard so we can see your name when you comment or have a question. Please keep all comments and questions related to the show topic, and remember, this is a safe space. I want to get, oh my God, please hold. Oh my God. Live stream has something for everyone, right? Oh my God. Okay, so that just screwed everything up. Where was I saying? If you want to, I wanted to introduce our, that frazzled me. Smoke alarm going off for no reason. I want to thank Ruth, Ray, Michelle, Kirsten, and Heidi. You guys rock for sponsoring the show. Thank you so much for doing so. If I even have a teleprompter, it's not working now. So anyway, if you would like to support the show, you can go to Patreon at Sherry Pallas, or Fireside Creators, Cafe Press at Sherry Pallas, or sherrypallas.com. You can become a VIP and get to chat on camera with the panel in the after show for only $3 a month. Thank you so much for supporting my work, but more importantly, thanks for being here and welcoming us into your home. Okay, I got through that. Tonight's show is on ableism. It's defined as a discrimination in favor of able-bodied people. Now, let's meet the panel so we can learn more about its prevalence, effects, and how we can help. Our first panel guest is Reverend Eric Braun. He is a priest in the Episcopal Diocese of Michigan. He's an experienced vocational educator and has served as a chaplain in area hospitals. Eric has cerebral palsy and recently transitioned to using a wheelchair in professional situations. Welcome, Eric.
Thank you, Sherry. Hello. Nice to see you.
Thank you so much for joining us. Sorry about the fire alarm.
No, that's okay. These things happen, like you say, live streaming.
I've never had to run off camera before. Okay, our next guest is Tracy Byrd Dickerson. Tracy became an RN BSN in 1987, specializing in oncology, parish nursing, and hospice and palliative care. She has an MACM, which is a Master's of Arts in Christian Ministry, focusing on health and spirituality from North Park Theological Seminary Center for Faith and Health. She also has an MDiv from Northern Seminary. For 10 years, Tracy worked for the U.S. government, Department of Defense, coordinating, educating, developing policy, and managing hospice, pain, palliative, supportive, and end-of-life programs and services within the Veterans Association. After sustaining 3 traumatic brain injuries within 4 years, Tracy retired and is now planning her not-for-profit concierge supportive palliative end-of-life doula practice, Kairos Doula Services. Whew, got that tongue twister going. Hi, Tracy. Thanks so much for joining us again.
You're welcome. I'm really glad to be here, but you didn't have to have a real fire in my honor.
Right? That's never happened.
Let's keep it fake from now on.
I know, there is literally no smoke. I have no idea what's going on.
That was hilarious.
But thank you. What a way to open a show. And completing our panel tonight is Allie Heater. Allie grew up secular, joined the Episcopal Church in high school, and went to seminary where she was diagnosed with Ehlers-Danlos, chronic fatigue, ADHD, and more. The Episcopal Church was very non-pastoral, and she was already having negative feelings about her involvement. Now, Allie is a full-time adoptions associate with one of the best shelters in the Midwest and a card-carrying member of the Satanic Temple. She is fully public, proud, and loud about disability rights and equality. Now I gotta find her. Hi, Allie. Welcome. And I lost my picture. Oh, goodness. Today is just today.
We roll with the punches. It's all
Yeah,
good.
you all got to see my vision board for a little while. That's on my computer, but hey.
No
Okay,
worries.
so I became aware of ableism a few years ago when I met someone who was born with brittle bone disease, which resulted in her becoming a little person. Before then, I never even fathomed the differences in abilities and just simply that my upper cabinets were completely inaccessible to her. A normal kitchen cabinets are completely inaccessible to little people. At 6 feet tall, something I never even pondered. So when we put this show on, it was like, oh my God, let's bring to light all of these different things that cause inequality in our societies because the way that people are born, because of things that happen to them that makes life so much harder. We will start with you, Eric. What are your thoughts?
Well, I'll tell you, for purposes of this discussion, I came to experience ableism later in life. As you said, I was born with cerebral palsy, but I was extremely lucky. I suppose, what you would call very high functioning, in that my disability is fairly minor. It only affected the way that I walk, as you mentioned in the intro, I only just recently started using a wheelchair. It was actually something that I had to do right before I started seminary because of my chaplain work. As you might imagine, it's important to get from one end of the hospital as quickly as possible. And being in a wheelchair was the one thing that I promised myself I would never do. It was my parents were fantastic. They were really super supportive, and even though I was growing up in my day, the term of art was handicapped. So I grew up as a handicapped kid, but I could still do almost anything that anybody else could do. So that's the mindset that I grew up with. I was really, really fortunate. But when I started to actively use the chair, because I had to use it professionally, number one, that was a condition that I had to come to terms with internally, because it changed the way that I saw myself. But I didn't realize how much it would change the way people saw me. On one hand, it can be a positive, because people sort of assume that, whether for good or ill, people sort of assume that if you're in the chair, nowadays they assume you're a vet. So I get a lot of that.
Oh, wow.
People assume that I'm a veteran, and I have to sort of gently correct them and say, no, but thank you. But because of that radical change in perspective, that, as I mentioned, is not only internal but also external, I didn't see, much like you say, you weren't aware, you didn't even think about your cabinets, didn't even think about getting around your own house, because why would you? It's your house. Yeah. You're fine, you're comfortable, it works for you. And until something directly affects you, you really don't think about it. And I didn't think about navigating the world as a person in a wheelchair until I had to. And then once I had to, you start to see all kinds of things. I'm aware of curb cuts. I plan my route into and out of buildings differently. I tend to arrive somewhere earlier than most people do, because I sort of have built into my expectations now that I'm going to have to figure out a way around this place that maybe other people won't. And that's so that's one thing. And then the other thing is that as a priest, despite some of our best efforts, a lot of the spaces in which I work are not handicap accessible, and they won't be. A lot of them are historic spaces, so changing them is either prohibitively expensive or just plain not allowed. Depending on the state you're in, or whatever the rules might be. Now, again, in the Diocese of Michigan, I am, again, very, very fortunate. My bishop has been very supportive and has told me flat out, tell me what you need and we will make it happen.
Good.
And I recognize that is, again, I understand how fortunate I am. I recognize that that's not the same for everybody. But I do have a new and fresh perspective because I'm relatively new to this game in terms of dealing with the world as a disabled person, at least new to my experience, more obvious than my experience had been previously. It does absolutely change the way that I understand and interact with the world around me. And there, it's little things, you know. It's like I often use my chair when I'm out and about because it's more stable. Other than that, you'll see me on crutches. And Allie knows this because we had met before. But the crutches aren't stable, and crutches make people nervous because the crutches make people think, oh, he's going to fall over or something's going to happen. So the chair is great, but physically the chair means I'm lower to the ground than the rest of the world, and it puts things literally out of reach. And so I have to ask for help a lot more often than I would have normally, and that takes some getting used to. So there's give and take. There's communication that has to happen on both sides. Like I said, a lot of this is internal, but there's a lot of reorienting of your expectations and your willingness to interact with people as well, other people. So there's a lot of changing of perspectives that has to happen.
She actually helped me to change my words to handy-capable, differently abled.
Yeah.
She even said that she calls the handicap spaces blue man parking.
Yep.
To change those, those things so we don't automatically consider or construe less than.
Yep.
Allie, what do you have to say about all this?
Yeah, so it's interesting because it's a similar but different in that, so with Ehlers-Danlos syndrome, it's a very rare, although they're learning it's less rare than they thought it was, but a genetic condition. That being said, when a lot of people hear genetic condition, they think, oh, you've known about it your whole life. I was very recently diagnosed, less than 10 years ago now. And very much it's one of those, oh, so that's why I sprained my ankle 3 times every summer. It's why I have loose and bendy joints that dislocate, and I've hurt myself in a multitude of ways. But it is very much something I'm learning at the same time. With me, it's an invisible disability. It's something that I have to tell people that I have. And when it comes to being at work, I do use a cane on occasion, but I don't have it every day. And thus I have to explain to people, no, I didn't injure myself. I didn't hurt myself. I just sometimes need this. And same with, I have a brace for every single joint that you can imagine. I've got shoulder, elbow, my fingers. These are actually braces because I will dislocate my fingers by typing.
Oh, wow.
And it does genuinely affect most of my day-to-day. But on my side of things, it's not visible. And in some ways that's a blessing because I don't have to disclose it to people if I don't want. But at the same time, it makes other sides of it much more difficult in having to explain a multitude of times that, yes, I do have this thing. And even though you can't see it, I am in pain. And even though you can't see it, I am always struggling with something. And that my disability is just as genuine and valid, and it exists just as much as the ones that you can see.
I think I say this every show. I just wish people would mind their own business and respect others. That's all we need to do.
Mm-hmm.
I want to give a quick shout out to David. Hello, David, and Anna. Hello, love. Okay, Tracy, what can you teach us tonight about this?
Well, I sort of have a little bit of Eric's story and a little bit of Allie's story. because as far as Eric, so many of the things that you say resonate with me. I'm 58 years old, and I was 58 years old when I realized that I had different abilities now, and they might be permanent. After 3 TBIs, they might be really, really permanent. And I've been a nurse for 35 years. I've been on the opposite end, opposite side of the bed rails. I've been the capable one. I've been the powerful one. I have been the one in control. I have been the one who's had it all together. And I'm also a pretty high functioning person who's always been able to juggle a lot of things. And that went from me being this juggler of many things and in charge of many people to not even being able to get words out of my mouth and looking drunk when I walked from a head injury from a car accident. And it was humbling, but it was also very eye-opening, because as I walked with a cane, I would notice how people would, like, one story is there's a ramp going down with guardrails on either side that I have to go on to get into a building. And one would think that if someone is coming down this ramp, that really two people could get by each other. But if it's somebody with a cane, it's a different story. So it's kind of like if you're driving down a road and there's cars parked, and you know how one person will be the nice guy, kind of wait there and then let the other guy go by. So one would think, and I guess it was because I always did it anyway, that if somebody is walking towards you down a hill with a cane, you would be the person who stops and let them go by. But that Eric can probably attest to this. You become very invisible when you have an assistive device, and people will rush past you. And it's really unhelpful. Like, I've had people nearly knock me over. And all the while not seeming to see me. And that was a new experience for me, because I had always been quote unquote normal, right? And I thought, oh my gosh, this is what it's like. This is just not okay. However, the other part of it is very much like Allie's story, in that a lot of my illness is invisible. So sometimes I feel invisible when I actually present as differently abled, but I also don't always present as differently abled. Right now, I am talking, and I think I sound okay, but you'll hear me stutter. You'll hear me grab for words. And I've spoken in front of crowds for many years, so I've developed an ability to be articulate. But if you were, I might forget a word when I'm talking, and or I might seem normal and might get to the register at a store and then not be able to say the word for credit card or something dumb, like just you can't even believe. And it's in those moments that I realized that my invisible illness is on, I have an invisible illness that people can't see. It's not like I have a big scar across anything, or, like I'm missing both arms or anything that's, or walking with the cane. So, I've hesitated whether or not I should get a handicapped placard, because it's really hard for me to walk long distances, because my balance has not been the same since the head injury, and my stamina is affected, because your brain does everything. So if my brain makes me walk across a parking lot from a far distance, then my brain, when I get to the cash register, is no longer going to be able to remember the word for credit card.
Oh, wow. Okay.
So I have to, use my spoons very, sparingly. And we'll probably all talk about spoon theory, right?
Oh,
Yeah.
100%.
We'll tell you about spoon theory. But so the thing is, so here I am. I look really normal, except if I like turn abruptly and then I just topple off into the sunset. So do I want to get a placard? But I know it's going to save me in the long run. But I know that somebody's going to be like, oh, she took her mother's or whatever, right? And so I experience guilt and shame over needing to do what I need to do to be able to do what I need to do, if that makes any sense. So I experience both the very visible aspects of disability where you are treated as if you're invisible, and then the very difficult part of having an sometimes invisible disability in which people might judge me differently, think I'm drunk or something rather than disabled. So that's my kind of mix. So now I've learned that, like anybody I bump into, unless unless they are smelling like an eighth of vodka or a fifth of vodka, listen to me, an eighth of vodka, a fifth of vodka, or holding a bottle in their hand and stumbling, I no longer think, oh, they must, my judgment level has changed because now I understand, oh my gosh, who knows? Who knows? So
I can 100% vouch for fear of getting a placard. Because as someone who, I look younger than I am. I am 30, but I always look young. That one benefit of Ehlers-Danlos, it affects your collagen, so I will look young forever.
Wow, nice.
But definitely, I have struggled because there were definitely times in my past before I was more on top of my illness that I would have really benefited from one. But genuinely, that fear of looking not disabled, and there's no one who looks disabled. Like, disability comes in so many different forms that we really need that internalized ableism is genuinely a thing, and that question of if we're disabled enough for it. But I can just say that fear of getting one and the fear of judgment that goes along with it if you don't feel like you look a certain way is so valid.
A friend of mine they've since passed, unfortunately. Her niece had cerebral palsy from a child and could not move, could not speak. So she was especially sensitive to anyone using the Blue Man parking. And one day she pulled up to Walmart and there was this woman in a big SUV just sitting there in the parking lot, and my girlfriend lost her shit. She got out, ran over to the car and started screaming at this woman saying, I've got, my niece really needs this parking spot. What are you doing here? And immediately accusatory. And the woman looked at her and said, I have brain cancer. Leave me alone. And I get goosebumps just thinking about it. And that taught me so much. One, not to assume, but also the people who are struggling can also assume too, like who is more needing of these types of things. There's two things that you guys have said that have struck me as not something I would have assumed. One, that you feel invisible. I would have assumed that you felt like people were looking at you. And two, the internal struggle that you guys go through when there is so much. I'm wearing my "It's the system is the problem" shirt because there is so much out there that's already going against you that you also have to deal with your own personal issues of accepting this fate of yours. Anyone care to go off of that?
Well, I'll say first off, let me advocate for get whatever you need. Absolutely, whatever it is, whatever you are entitled to. I love the phrase "the Blue Man parking." Amongst my circle of friends, we call it Mr. Wheelie.
There you go.
But it's the same deal, right?
Why is it always a man?
No. That's a great question. There's a story. I have a story, but I won't
Go ahead.
tell it now.
Go ahead,
But
Eric.
anyway, but take whatever you need. Get whatever you are entitled to. There is a reason why those things exist. And speaking for myself again, I was a mess when I went in for my chair fitting, because it was a thing again that I had promised myself I would never do. But I had a really frank conversation with my personal priest, who has since retired. But she came to me and said, "Look, here's the deal. Do you want to hold on to your pride, or do you want to do the work?" And that was the secret sauce for me, right? That was the question that made a difference for me. Now, everybody else has their own question and their own situation that they have to reconcile. And I don't pretend to know what that is or how to navigate through that. I know that I would not have been able to do it by myself. I would have clung to my identity, and I would have clung to that stubbornness, and I would have tried to power through and probably failed and made myself miserable for want of resisting this change. So that's one thing. And that's, for me, that's what cracked everything open and made everything else possible. So I can speak a little bit to the idea that you said, Sherry, that you assume that you can't help but be noticed. That's also true.
Okay.
But boy, does it really depend on what the disability is. Again, in my case, yeah, I mean, you can't tell, but I'm 6 foot tall. I walk into a room, you're gonna see me. And if I'm in the chair, you're gonna know it. And there is something to be said for knowing that people see you when you walk into a room. Sometimes that's an advantage, sometimes not. And that attention isn't always a good thing. Different people deal with it in different ways. Not everybody is comfortable with it, nor should they be, nor do they have to be. I'm certainly not, and I'm glad that we have so many different viewpoints on the panel, because I think sometimes the danger whenever you have discussions like this is somebody will say, well, I did this, and everybody sort of gets into their head that, oh, well, I have to be like that person. I have to do it the way they did. And that is absolutely not true.
I'm glad you pointed that out.
Yeah, I think Eric makes a really good point. And I would just say that, a lot of people would like to think that if you've gotten one disabled person's point of view, you've gotten the point of view. But it's like, if you've seen one disabled person, you've seen one disabled person, and you've gotten their perspective. I mean, even the story of your friend who had brain cancer and who got accosted by another person from another, and we often say disabled communities, because there isn't a disabled or a handicapped, however you want to call it, community. It's communities. And you'll I'm in a support group for women who have brain injuries, and the reason it's for women is because hormonally it tends to affect us differently, not because of the different hormones that we have. It's going to affect the different neurotransmitters in our brain, but also our perspectives may be very different with our, what we do in life, and how, mothers who run whole households, and we can commiserate about that. But so if talking about the disability communities, I was a member of a different disability community when my brother was diagnosed with ALS, Lou Gehrig's disease. He died 3 years ago at the age of 50, and I was one of his caregivers. I was able-bodied and healthy, and I was the strong one, and I was not the vulnerable person. I in the power, dynamics, I was the person with the power. And I drove his van for him and took him to appointments, and we had the handicap van, and I would strap him in and do all that stuff. And let me tell you, man, I felt entitled. And if I probably would have been that person who said, I wouldn't have said anything, but I would have said it under my breath. I would have judged me now for looking normal, and why does she get the spot? So I've been in both communities, and I totally get it. So we are not monolithic, that is for sure. Even though we all struggle with similar things, it is very different for each and every one of us.
I think
Yeah.
that applies to all the communities, that we shouldn't do broad strokes on anything, especially the differently abled, because as all three of you sit here, you know, there's totally different abilities and what you guys are dealing with. Allie?
I think so. The one strong thing that I think hit me the most when I was diagnosed and finally came to terms was that disabled is the one minority that the majority of people are going to be in at one point in time. That I think by the age of 35, I think 50% of people are going to experience some disability in one way, shape, or form, whether it's temporary or long term. So it is a minority, but it's one that most people at one point in their lives will experience. And I think that was the thing that struck me the most and made me kind of start second guessing and thinking about all of those things that I had kind of brushed off on how many doors in a building are actually accessible, and what is the difference between having a solid curb or a curb cut, and all of these things that now I look for, because more likely than not in the next 10 to 15 years I'm going to be relying on some kind of assistive device. Ehlers-Danlos is a lifelong illness that does progress, and I'm on top of it now, and I have great doctors. Benefit of living in Cleveland, Ohio. Cleveland Clinic is amazing. But more likely than not, I will need all of these assistive devices, whether it's a wheelchair or using my cane more regularly or what have you. And so recognizing those things as an otherwise able-bodied person, because more likely than not, either yourself or someone you know is going to need them. And I think that hit me the hardest, because it's like, yeah, everyone plans on getting old in one way, shape, or form, but we don't really plan for what goes along with that. And then on the second side, it's the things that are genetic or lifelong conditions that you don't have the luxury of learning about. You just live with them. And I think that just changes your perspective and changes the way of approaching things. It is a lifelong thing, disability, whether you have it now or in the future, or if it ends up that you're lucky and it's a friend or a family member, but it is going to touch you at some point in your life.
Unfortunately.
Mm-hmm.
So before we get into what these spoons are, I want to bring on Anna's question. As many of you know, I have two kiddos, 10 and 12, who have mental illnesses in the form of disorders. One may have a visual disability. What advice do you have for parents who can't find many resources for the young ones and are frustrated and exhausted? These are invisible issues that manifest in the worst of ways. And hi, Bells, how are you? So who would like to tackle that question? Uh-oh.
Well, first off, let me say, parents of disabled children are amazing, absolutely amazing, because
Anna's one of those.
They are their children's fiercest advocate, and they have to be, and that's often a thankless job. And so I understand that when I understand how you can feel. So I know my mother said the same, or felt that way often too. Is like, why is everything so hard? Why does this have to be so hard? And it's not that there aren't resources, and I should say there are resources, but boy, does it depend on where you are. Some communities are great, some regions are fantastic and are awash with resources, others not so much. And so I wish that it were a little more uniform across the board. Unfortunately, as we all know, it's not. the only thing I can say is I would look to private foundations and other institutions, because I guarantee you that there is a foundation or some sort of social organization that caters to whatever your situation might be. I promise you it exists. It may not be well known. You may have to go looking for it, but I promise you that it's there. So a healthy use of Dr. Google is the first thing I would suggest, because once you find out that you're not the only one who has to deal with this, that changes your game. It really does change, because it changes your options. Very often, people I've talked to, just as a chaplain, when somebody gets a life-changing diagnosis, the first thing they think is, "Oh my gosh, why did this happen to me?" And what I often say is, "Well, it didn't happen to just you." And by that I mean this has happened before, right? The other people have this or have had to deal with this condition, and so there are resources. Don't be afraid to go looking, though, in I'm going to say the private sector, because I can't think of a better term for that right now. But there are resources out there. Unfortunately, it does, however, fall to parents to be their child's advocate. But don't do that alone either. Therapy is necessary for everybody.
Yeah.
Oh no, Tracy, please.
I was just going to say, find your people, find your community, find your people. They will guide you. There are going to be people ahead of you that have had similar enough experiences that they can mentor you. There will be people behind you that are newer than you that will make you not feel like a newbie, and you will be able to mentor them. And you will all normalize one another so that you don't feel alone. You don't feel like you're walking in the dark alone. You're walking with other people. There is nothing better than that. There is absolutely nothing better. Even if I'll bet you can find a group on Facebook. And that may sound really dumb, like look for a Facebook group. But it was the best thing. My speech therapist actually told me, you need to join this group called Pink Concussions. And that made all the difference, because I could write in there, does anybody else have this happen? And, something as simple as one weekend, everything I looked at looked like I was looking at the heat that comes off of a fire.
Oh, wow.
Well, everything looked like that. And first I thought it was kind of weird and like, oh, that's weird. And when it lasted all weekend, I finally went on and I was like, does anybody else have this? And they were like, oh yeah, you're having a visual migraine. And I was like, what? Right. So simple stuff like that. I can speak to that. I know in the ALS community, my sister-in-law, her husband was dying of ALS and she had to be his caregiver. She wasn't medical. And let me just tell you, caring for people with ALS is daunting, even for people like me who have been doing end of life care for ever. It's daunting. It is grueling work emotionally and physically. And you're doing it when you're doing it for a spouse. I mean, so she got in a spouse group for ALS. She was in one that covered the whole country. Now she's a life coach, and this is what she does because she got good at it, sadly, but she got good at it. And she's able to, so, there are people out there. You just have to find your people. Allie, it's yours.
Yeah. And I was honestly going to say the exact same thing. It might seem silly, but social media is a blessing. Right now, it is an amazing gift that we live in this day and age, that we can be in contact with hundreds of thousands of people at one time. Social media is definitely something not to sleep on. There is a group for everything. And once you find those groups, you have people that can be a sounding board of exactly what you said, Tracy, that is this just me, or is this really something that's happening? And that's something I know, like, coming to terms with disability, a lot of what I thought was just like, oh, quirks of myself and my family. It's like, oh no, that was a sign of an illness. that was a sign that I've had this my whole life. But also kind of piggybacking off of Eric, Dr. Google's not really the worst thing in the world, especially in this day and age where we can be in contact with so many people. From a personal standpoint, Ehlers-Danlos being a somewhat rare illness, I've known in one way, shape, or form that I've been sick since I hit puberty. Like, I've known that something was up, and it took 10, 15 years of advocating and saying, hey, like this, me fainting because I took a shower is not normal. Me dislocating things and falling downstairs when nothing was happening is not normal. That me sleeping wrong and then waking up with a dislocated leg is not normal. Like, all of these things. And you do have to advocate for yourself. But I found out that I had Ehlers-Danlos because of Dr. Google, because I was connected with someone who said, you really should look into this, you should Google this, and was then able to find the diagnostic criteria and go to my doctor and ask for a specialist visit and say, like, I know this sounds silly, but I think I have this and I meet all of these criteria. There's definitely a downside of it in that within reason, Dr. Google is fun or is good, is fine. But definitely with
discernment,
some with a little discernment, with some kind of reason thrown in there.
Yeah.
If your head hurts, more likely than not, it's probably not something dire. It's probably just a headache. But at the same time, with those bigger things that are life concerns, and especially when it comes to rare illnesses, the joke in medical fields is if you hear hoofbeats, it's probably horses and not zebras. And that's half of why with Ehlers-Danlos, the kind of sign is a zebra, because we are that special thing. Something is actually wrong. But so social media and Googling and reaching out into the void that is social media and web search and specialty fields, search for those specific illnesses, even if you're just contemplating if it is something that could apply to the kids. Like, it never hurts to research. It never hurts to learn, and if nothing else, you learn about something that can help someone else. If it doesn't end up being something that affects your family immediately. But above all else, believe what they're telling you and advocate for them when doctors and people in power try to say that they're overstepping, that they're making it seem worse than it is, because personally speaking, having growing pains when you're a 20-year-old isn't normal, and it's probably not growing pains.
I think
So,
that
believe
Facebook
your
groups
kids.
are something that doesn't come to mind, at least for me, immediately. But last week's show was on the Mama Bears, and their group has literally changed lives. They have 34,000 members now, and they're saving lives across the planet. So I think that Facebook, love it or hate it or whatever, those groups are support groups on the internet. They're fabulous and can really be there for enormous information, support, and all of those types of things. And she has another question. What has been the best way for you to normalize what's normal for you now?
Boy.
Whoever wants to jump in first.
Same answer.
Same answer? Okay. Yeah.
Same answer.
Honestly, yeah, social media, being in contact with other people who tell me it's not just in my head.
Yeah.
Well, and say something, when something happens, when you're going through something, tell somebody, and let people see you. That's sometimes a hard thing to do, even when your condition is a little more obvious. I used to always say, whenever I see a little kid, because kids are great. Kids will look and they'll want to know what's going on, and so they'll ask their parents and say, why did they look like that, or why are they doing that, or what's going on? And the parents, because they mean well, will always say, oh, no, don't look, or oh, don't make a fuss. I will go out of my way to find that child and say, it's okay, what do you want to know?
That's beautiful.
Because I would much rather tell them, oh, you know what, yeah, I'm using my crutches today because, I have to work, I have to get around a little differently, or something like that. But I would much rather normalize that response than don't look.
Yeah.
Right.
And
so
Eric and Tracy, you probably would also be able to say something to this effect, but I think part of normalizing what's now normal is a little bit of discomfort and just a little bit of like getting outside of your comfort zone. Thinking back to when I thankfully haven't needed it very much, so I don't walk with a cane very often anymore. But I definitely, the first time I used my cane was actually on a weekend in seminary. And it was very, very uncomfortable. It was something I was not yet ready for, but I knew in the back of my head that I needed. And that weekend of being with people who I knew I was safe with, and being with people who I knew wouldn't have negative judgments associated helped. But a weekend of kind of forcing myself to accept where I was led to me being a lot more comfortable with it now. That voice is still sometimes in the back of my head saying, you don't need this as much as other people, but it's fighting that voice, and a new normal is ever changing.
Yeah, what is normal, right?
Well, and even from day to day, it's different. Because my physical response, and I'll bet that there's something similar going on for the three of us. From day to day, my physical response is a little bit different. Some days are great days, and I don't need much help. And other days, I'm like, oh boy, this is going to be rough. I'm going to need every bit I can get. And I never know which is going to be which. So it's just one of those things. But again, it starts internally, and then you're able to say to people around you, here's what I need. And that takes work, because we're also socialized to not ask for help. And at least at least in the United States, we don't, that's a bad thing, right? You shouldn't need help. You should be able to do everything yourself. Why are you making a big fuss? All those things. And sometimes, and then depending on what individual communities we're in, sometimes it's worse.
Oh my God. The phrase "I need help" will bring me to my knees. I mean, it's so vulnerable and it's so hard to ask. And the fact that's part of your acceptance breaks my heart, because I know how hard that is, in addition to everything else you're going through. Okay, so explain these spoons. Tell me about these spoons.
Who wants to start? I'll start. First of all, Google it.
Okay.
Eric.
I'm afraid to, but okay. I mean, for different reasons.
I feel so bad talking about it though, without really knowing who to attribute it to. Do either of you guys know the person who invented it?
I don't. Right? Yeah, we're gonna Google it, but I don't know either.
Yeah, so basically, spoons was developed by, Allie will tell us in a minute, a young woman, I believe.
Yes.
And she was actually, I think, out with a friend, and they were at a diner, and she was trying to explain to her friend her energy levels and her ability to get things done with an illness, a chronic illness. And the only thing that was on the table were spoons. And she lined up a bunch of spoons, and she said, this is the amount of energy I have in a day. And if I use this spoon for showering, and she plunked it down, then I don't Now I have 11 spoons, and I'm going to need one to walk across the parking lot to get into work. I'm going to need another one to deal with an angry customer. And thus the phrase, I don't have enough spoons for that, is now in the lexicon of modern American English. So, Allie, who was it?
It was a woman named, I am atrocious with last names, so my apologies to this person, but Christine Miserandino. And yeah, she is an individual who lives with lupus.
She was what? What was her?
Lives with lupus.
Lupus.
Yeah.
Okay. Funny side note, I was diagnosed with lupus when I was 27, I think.
Oh,
misdiagnosed, and had the diagnosis for 20 years.
Wow.
I had 5 or 6 different rheumatologists who I fit all the criteria. It turned out that I had Hashimoto's thyroiditis, which is also an autoimmune disease.
Yeah.
Well, it's another invisible illness, but that just goes to show that advocate for yourself. I think a really good article that just came out, and I would say if you Google nothing else after watching the show, Google New York Times, put in gaslighting, how not to be gaslit by your doctor. Medical gaslighting, I think it might be. But do we all resonate with that, Eric? I mean,
yeah.
Allie,
yeah.
having with my autoimmune disorder, I actually had a nurse practitioner tell me there's nothing wrong with you, that a little Prozac won't help. I had an appallingly horrible autoimmune disorder that was uncontrolled, and I was getting sicker and sicker, to the point where my muscles were twitching visibly. You could see them across the room twitching. And I was like, I don't think that's all in my head, So there is the medical gaslighting is a real thing, and it is absolutely incumbent upon and us, those of us who are ill, to advocate for ourselves. The problem is we're in the worst possible position to do it because we're exhausted. We don't
have the spoons to advocate for ourselves.
Right.
What?
That's true.
We don't have the spoons to fight.
Right after I had cancer, Allie, you mentioned that, everybody will go through disabilities. I have a friend that said, I've known you for 15 years. I've never known you not having something wrong with your foot. I've broken my foot a million times. But when I got cancer, I made sure everything was taken care of, take it all out, do everything so I didn't have to go through all these extra things. And the doctor put me on an anti-cancer drug afterwards that paralyzed me within 2 weeks. When I went back to him, no one could figure out what was going on, why I couldn't move. I literally just had this. Couldn't dress, I couldn't shower, I couldn't even open doors for almost a year. And the doctor said to me, why don't you come back when you're not so emotional? Or his nurse practitioner said, you don't have it that bad because you're not in the hospital. So really, to advocate for yourself, I always joke that doctors practice and we have to be patient. But to find that spoon to do so, because I've been there. I couldn't even raise my arms to scream at him and to talk with my hands and to tell him how mad I was. Yes. And it was all because of just a drug that he had given me. So I really advocate for yourself, advocate for your health. Go to Dr. Google, stay away from WebMD so much.
And I think too, one of the biggest pieces of advice, I think this was in some article, but brain fog has made me forget where it's at. But biggest and most important part of advice is, if you don't agree with your doctor and they're saying they don't want to run tests, they don't want to try for something, just tell them to put that in their record. Like, I want you to write in the notes and put it like in writing that you are denying doing this. Because if nothing else, having it in writing helps you when you go to another doctor.
Yeah.
But the act of asking them to put it in writing can sometimes get them to change their minds.
They don't want proof.
Mm-hmm.
Yes,
Okay,
you are correct about that, Allie. That is a very good technique.
Mm-hmm.
To actually say to the doctor, so I understand that you don't believe that I have X, Y, or Z. I would like you to put that in my chart that I've told you that I think I have X, Y, or Z, and that you don't believe that I have X, Y, or Z. I want that put in my chart. Right? That's what you're saying, Allie.
Yeah.
And it is very effective at having somebody, having physicians will make referrals. Well, I'll send you to see a rheumatologist then.
Mm-hmm.
Yeah.
Yeah, you're calling their bluff. You're you're throwing the gauntlet down. Go ahead. Yeah. Because otherwise they're gonna write in your chart whether you ask them or not. They're gonna write things like non-compliant, hysterical, whatever, and this happens to women far more than it does to men. Far more. It's a very common phenomenon.
Mm-hmm.
Yeah.
Do we have any, we are at the top of the hour, so do we have any other things that need to get out there before we say our final words? Anything that you really want to stress and that people should know? Okay, I'll take that silence as a no. Eric, because you're up top, what are your final words and where can people find you?
Oh my gosh. Well, you can find me on Facebook. I think, and I will be my next stop in terms of continuing my work in my ministry. I will be doing a long-term chaplain placement at a hospital in Ann Arbor very, very soon. At the end of this month is when that rotation starts. So so that's the next thing that I'm out for. So I'm jumping right back into chaplaincy, which is what I wanted to do in the first place. So I'm very happy that that's going to happen soon. And I just want to thank you for this platform, and thank you for addressing the issue of ableism in the first place. I did not think just a handful of years ago that it would be something that I am in the middle of the way that I am. So thank you for giving all of us somewhere to give this a little more exposure, because like as we've said, whether you think you're going to go through this or not, eventually, yes, you will. And that's maybe that's one of the most useful things I've heard tonight. So I just want to thank you, and thanks to the rest of the panel for such a great discussion.
Well, and thank you for coming on, taking the time and your vulnerability. I really appreciate it. Allie, any final words, and where can people find you?
Yeah, people can find me on Facebook, Allie Heater. You can also find me on Instagram at BrainFogBabe. You can also find me Monday nights on Twitch playing Dungeons and Dragons with a bunch of really awesome people,
D&D.
One of my close friends who also has cerebral palsy. We game on Twitch, Almora RPG, and I just want to say thank you to you for bringing us together and having this platform, letting us kind of talk and bring some light to these issues. And yes, she put up, so my kind of personal motto is a Irish saying, Tadagan Aracht, nothing without effort. And that is something I try to live by and try to understand. Every day there is something. So biggest point in life is that you just have to get through it.
Right? Adulting is like so overrated.
Exactly.
Tracy, my dear, any final words, and where can people find you?
Final words, find your community, hold your spoons close to your chest. Don't use them for things that aren't worth it.
There you go.
Ever. Even when you're well, you still have only so many spoons. You only find out that you have so many spoons when you have something happen to you and you realize that you're actually finite. We all are finite, however.
Yeah.
And living within our finitude is learning to do that is a blessing. It's a blessing. I'm at Tracy Byrd Dickerson on Facebook, and I'm Tracy Dickerson on Twitter. And thank you for allowing us to give voice to something people don't often talk about,
Or unaware of.
isms that doesn't get talked about.
Yeah.
Right on.
I want to thank you all for your vulnerability and for taking the time and trying to educate others to make everybody's life a little bit better. So thank you so much for spending the time and coming on.
Thank you.
I'm going to send you all backstage. I'll talk to you in a minute. Oh, thank you so much to our fabulous panel. I learned so much tonight, and there goes my thing again. I will get this fixed for next week. So many different stereotypes that I thought were assumed that wasn't there. I will definitely make sure that people around me, I usually try and help and push the wheelchairs and stuff like that, but maybe ask and honor people more. And to stop with the judgment and to stop with all of those things. For next week's show, we will be chatting with the survivors of conversion therapy. A few weeks ago, we met the godfathers of conversion therapy, and next week we will get to chat with 3 of its survivors. Be sure to hit that like and subscribe, and thank you all for watching and participating. If you enjoyed the show, please consider sharing it with some of your friends. We're headed over to the VIP to continue the conversation. Become a member so you can chat too. Go to sherrypalace.com and hit the support tab, and hope to see you there. Thanks again, and I will see you next week. As you know, walk in love. Mwah.